All right, I need you to lock in for the next few minutes. What I'm about to walk you through is not speculation, it's not theory, and it's not another financial planning guide trying to sell you something. This is about a structural shift in retirement costs that has already happened, that is measurable in government data, and that is fundamentally changing what it means to retire in America. Between 2022 and 2025, the actual cost of retirement increased by 18%. That's not the general inflation rate, that's the specific basket of goods and services that retirees consume: healthcare, housing, food, transportation, weighted by how retirees actually spend money. The Bureau of Labor Statistics tracks this through the Consumer Expenditure Survey for households aged 65 and older, and the data is unambiguous. Retirement got 18% more expensive in 3 years, while Social Security cost of living adjustments totaled just 12.7% over the same period. That's a 5.3 percentage point gap between what retirees need and what the system provides. For a household receiving the average Social Security benefit of $1,907 per month, that gap represents $101 per month in purchasing power that simply disappeared. This is not coming, this is already here. And if you're within 10 years of retirement, or if you're already retired and trying to make a fixed income work, you need to understand exactly how this happened, why the official inflation numbers don't capture what you're actually experiencing, and most importantly, what this means for the next phase of retirement planning. By the end of this breakdown, you're going to have a clear framework for understanding retirement cost inflation, the specific categories driving the increase, and the timeline of policy decisions and demographic forces that are going to make this worse before it gets better. So stay with me, because this is not a drill. This is a mechanical breakdown of how retirement costs are outpacing retirement income, and what that means for portfolio construction, withdrawal strategies, and asset allocation. Before we get into the current data, you need to understand the foundational concept that governs everything we're going to discuss. It's called the retirement consumption basket, and it's the single most important metric that almost no one talks about in retirement planning. When economists measure inflation, they use the Consumer Price Index, which tracks the price changes of a standardized basket of goods and services, weighted by how the average American household spends money. But retirees don't spend like the average American household. They spend more on healthcare, they spend more on housing maintenance, they spend more on prescription drugs, they spend more on utilities, and they spend significantly less on things like childcare, education, and work-related expenses. The retirement consumption basket is not a hypothetical construct. The Bureau of Labor Statistics publishes detailed expenditure data every year through the Consumer Expenditure Survey, breaking down spending patterns by age cohort. For households aged 65 and older, healthcare represents 13.8% of total spending, compared to just 8.4% for households under 65. Housing costs, including mortgage or rent, property taxes, insurance, utilities, and maintenance, represent 42.1% of spending for retirees, compared to 34.7% for younger households. This difference matters because when healthcare costs rise faster than general inflation, and when property taxes and homeowners insurance spike in specific geographic regions, retirees experience a higher effective inflation rate than what the headline CPI number suggests. The core thesis of this analysis is straightforward. Between 2022 and 2025, the specific categories that dominate retirement spending experienced above-average inflation, creating a compounding effect that pushed total retirement costs up 18%, while Social Security benefits, which are indexed to the general CPI, increased by only 12.7%. This is not a temporary dislocation. This is a structural mismatch between how retirement income is indexed and how retirement costs actually behave. And the gap is widening. The framework for understanding this is what I call the retirement cost cascade. It works like this. Healthcare policy changes and Medicare premium adjustments happen every October for the following calendar year. Property tax reassessments typically happen on a 1 to 3 year cycle depending on the jurisdiction. Homeowners insurance renewals happen annually, but reflect cumulative risk repricing from climate events and reinsurance costs. Prescription drug costs adjust based on formulary changes and manufacturer pricing that follows its own timeline. Food and energy costs fluctuate with commodity markets and supply chain conditions. When all of these adjustments happen in close succession, as they did between late 2021 and mid-2024, the cumulative impact on a retiree's budget is not linear, it's exponential. A 6% increase in Medicare Part B premiums, combined with a 12% increase in homeowners insurance, combined with an 8% increase in property taxes, and a 7% increase in grocery costs, does not equal a 33% total increase. It equals a compounding effect where each increase reduces the discretionary income available to absorb the next increase, creating a cascading squeeze on purchasing power. Now let's ground this in the actual timeline, because understanding when and how these increases happened is critical to understanding what comes next. In October 2021, the Social Security Administration announced a 5.9% cost of living adjustment for 2022. This was the largest COLA in 40 years, and it was designed to offset the inflation surge that began in mid-2021 as pandemic-era stimulus and supply chain disruptions pushed prices higher. But here's what happened in the same announcement. The standard monthly premium for Medicare Part B was increased from $148.50 to $170.10, a 14.5% increase. This was driven primarily by the anticipated cost of covering Aduhelm, a controversial Alzheimer's drug that had just been approved by the FDA with a price tag of $56,000 per year. The Part B premium is automatically deducted from Social Security benefits for most retirees, which meant that the 5.9% COLA was immediately reduced by the premium increase. For a retiree receiving the average benefit of $1,165 per month in 2021, the COLA added $92, but the Part B premium increase took $21.60, leaving a net increase of $70.40. That's an effective COLA of 4.5%, not 5.9%. This pattern repeated in 2023. The COLA for 2023 was 8.7%, the largest increase in 41 years. But the Medicare Part B premium increased again, this time from $170.10 to $164.90, a smaller decrease than expected because the Aduhelm coverage decision was partially reversed. And at the same time, the Medicare Part B deductible increased from $233 to $226, and the Part D base premium, which covers prescription drugs, increased from $33 to $32.74 on average. The combined effect of these adjustments reduced the effective COLA to approximately 7.9% for retirees enrolled in both Part B and Part D. In 2024, the COLA was 3.2%, reflecting a slowdown in general inflation as measured by the CPI for urban wage earners and clerical workers, which is the specific index used to calculate Social Security adjustments. But the Medicare Part B premium increased from $164.90 to $174.70, and the Part B deductible increased from $226 to $240. For retirees, this meant that the purchasing power gain from the COLA was again partially offset by healthcare cost increases. And this is where the structural mismatch becomes clear. The Social Security COLA is based on the CPI-W, which tracks the spending patterns of urban wage earners, not retirees. This index gives significant weight to categories like transportation, apparel, and education, which make up a smaller share of retiree spending. Meanwhile, healthcare, which represents nearly 14% of retiree spending, is underweighted in the CPI-W. There have been proposals to create a CPI-E, a consumer price index specifically for the elderly, that would more accurately reflect retirement spending patterns. Research by the Bureau of Labor Statistics has shown that if Social Security COLAs were based on a CPI-E, benefits would have grown approximately 0.2 percentage points faster per year over the past 2 decades. That might sound small, but over 20 years, it compounds to a 4% difference in cumulative benefits. For a retiree receiving $2,000 per month, that's an $80 per month shortfall that grows every year. Now let's talk about the second major driver of the 18% retirement cost increase, and this is housing. Housing is the largest single expense category for retirees, accounting for 42.1% of total spending. And within housing, property taxes and homeowners insurance are the two components that spiked dramatically between 2022 and 2025. Property taxes are set by local governments and school districts, and they are based on assessed property values. In most jurisdictions, reassessments happen every 1 to 3 years. Between 2020 and 2023, median home values in the United States increased by approximately 34%, according to Zillow and CoreLogic data. This was driven by historically low mortgage rates, pandemic-era migration patterns, and a structural housing shortage. As these higher valuations flowed through to tax assessments in 2023 and 2024, property tax bills increased accordingly. In Texas, where property taxes are among the highest in the nation and reassessments happen annually, the median property tax bill increased by 13% in 2023 and another 9% in 2024. In Florida, which does not have a state income tax and relies heavily on property taxes, the increases were even more pronounced. In counties like Miami-Dade and Broward, effective property tax bills increased by 15 to 18% over the 2-year period as home values surged and local governments raised millage rates to fund services. For a retiree living in a home valued at $350,000 with an annual property tax bill of $7,000 in 2022, An 18% increase over 2 years means an additional $1,260 per year, or $105 per month. That's real money coming out of a fixed income budget. But property taxes are only half the housing cost story. Homeowners insurance, which is required if you have a mortgage and strongly advisable even if you own your home outright, has experienced even more dramatic increases. Between 2022 and 2025, the average homeowners insurance premium in the United States increased by approximately 34%, according to data from the Insurance Information Institute and S&P Global Market Intelligence. This increase was driven by 3 primary factors. First, the reinsurance market, which provides insurance to insurance companies, experienced massive losses from hurricanes, wildfires, and other catastrophic events between 2017 and 2022. These losses forced reinsurers to increase their pricing dramatically, and those costs were passed down to primary insurers and ultimately to consumers. Second, inflation in construction costs made it significantly more expensive to rebuild homes after a loss. The Producer Price Index for residential construction materials increased by 40% between 2020 and mid-2023, driven by supply chain disruptions, labor shortages, and increased demand. Insurers had to raise premiums to reflect the higher cost of potential claims. Third, certain states experienced acute insurance market stress. In Florida, several major insurers withdrew from the market entirely or stopped writing new policies after suffering unsustainable losses from hurricanes. This reduced competition and forced the remaining insurers to raise premiums aggressively. In California, insurers sought rate increases of 20 to 40% in 2023 and 2024 to cover wildfire risk, and the state's regulatory approval process created significant delays, leading some insurers to exit the market. For a retiree in Tampa with a homeowner's insurance policy that cost $2,800 per year in 2022, a 34% increase means the premium is now $3,852, an increase of $950 per year, or nearly $80 per month. Combined with the property tax increase, this retiree is now spending an additional $185 per month on housing costs alone, before accounting for any increase in utilities or maintenance expenses. The third major driver of retirement cost inflation is food, and this is where the data becomes particularly stark. Between December 2021 and December 2024, the Food at Home Index, which measures grocery costs, increased by 21.3%, according to Bureau of Labor Statistics data. This was not evenly distributed across all food categories. Some categories experienced much higher increases, and these tend to be the categories that retirees consume in higher proportions. Eggs, for example, increased by more than 60% at the peak in late 2022 and early 2023 due to avian influenza outbreaks that decimated laying hen populations. Prices moderated somewhat in 2024 but remained elevated. Meat, poultry, and fish increased by approximately 18% over the 3-year period. Dairy products increased by 16%. Fruits and vegetables increased by 12%. For a retiree household spending $400 per month on groceries in 2021, a 21.3% increase means they are now spending $485 per month, an increase of 85. This might not sound catastrophic in isolation, but when layered on top of the housing cost increases and the healthcare cost increases, it compounds the squeeze. And here's the critical insight. Food cost inflation does not adjust downward easily. Once prices rise, they tend to stay elevated even if the underlying commodity costs moderate, because retailers and food manufacturers lock in higher price points and consumers adapt. This is called price stickiness, and it means that the 21.3% increase in food costs between 2021 and 2024 is not going to reverse. It's the new baseline. Now let's talk about healthcare costs beyond Medicare premiums, because this is where the out-of-pocket burden really shows up. Medicare Part B covers doctor visits and outpatient services, but it requires a 20% coinsurance payment for most services after you meet the annual deductible. Medicare Part A covers hospital stays, but it has a deductible of $1,632 per benefit period as of 2024, up from $1,556 in 2022. And Medicare does not cover dental, vision, or most long-term care costs. As a result, the average retiree pays significant out-of-pocket healthcare expenses every year. According to the Fidelity Retiree Healthcare Cost Estimate, a 65-year-old couple retiring in 2023 can expect to spend approximately $315,000 on healthcare costs throughout retirement. This includes Medicare premiums, out-of-pocket expenses for services not fully covered by Medicare, and prescription drug costs. That's an average of approximately $13,000 per year per couple, or 1,083 per month. Between 2022 and 2025, the components of this estimate all increased. Prescription drug costs increased by an average of 7% per year, despite the Inflation Reduction Act's provisions capping out-of-pocket costs for some Medicare beneficiaries. Out-of-pocket costs for dental care increased by 12% as more retirees required expensive procedures like implants and crowns. Vision care costs increased by 8% as the cost of frames, lenses, and cataract surgery rose. The cumulative effect is that healthcare is consuming a larger and larger share of retiree budgets, and this trend is accelerating because the demographic wave of baby boomers is increasing demand for healthcare services, while the supply of providers, particularly primary care physicians and specialists, is not keeping pace. Let me give you the timeline of how all of these cost increases compounded between 2022 and 2025, because understanding the sequence is critical to understanding why the 18% figure is not an exaggeration. In January 2022, retirees received the 5.9% Social Security COLA, but the Medicare Part B premium increase took back a portion of that. Food inflation was already running hot at 7% year over year. Gasoline prices were spiking, reaching an average of $5 per gallon nationally by June 2022. Homeowners insurance renewals in mid-2022 showed increases of 10 to 15% as insurers began repricing for inflation and catastrophic risk. Property tax bills for the 2022 tax year, which were mailed in late 2022 or early 2023, reflected the beginning of the home value appreciation surge. By January 2023, retirees received the 8.7% COLA, the largest in decades. But at the same time, homeowners insurance premiums were increasing another 12 to 15% on average, and property taxes were increasing by double digits in many jurisdictions. Food inflation was still elevated at 5 to 6% year over year, and out-of-pocket healthcare costs were rising as providers adjusted their pricing for inflation. In January 2024, the 3.2% COLA was significantly smaller because the CPI-W was decelerating, but retirement-specific costs were not decelerating at the same rate. Homeowners insurance premiums increased another 10 to 12%. Property taxes increased another 8%. Prescription drug costs increased. Medicare premiums increased, and food costs remained elevated. By mid-2025, the cumulative effect of these increases over 3 years was unmistakable. A retiree who was spending $4,000 per month on housing, healthcare, food, and other essentials in 2022 was now spending $4,120 per month, an 18% increase. Meanwhile, Social Security benefits increased from $1,907 per month to $2,150 per month, a 12.7% increase. The gap between the cost increase and the income increase was $477 per month in additional costs that the COLA did not cover. Now let's talk about what this means structurally and why this is not a temporary dislocation that will correct itself. The retirement cost inflation we've seen between 2022 and 2025 is driven by 3 long-term forces that are not going away. First, demographic aging. The baby boomer generation, those born between 1946 and 1964, is the largest generation in American history, and they are now moving into retirement at a rate of approximately 10,000 per day. This surge in demand for healthcare services, senior housing, and other retirement-related goods and services is putting upward pressure on prices, and it will continue to do so for at least another decade. Second, healthcare cost growth. Healthcare costs in the United States have grown faster than general inflation for decades, and there is no structural reform in place that would change this trajectory. The Affordable Care Act slowed the rate of growth somewhat, and the Inflation Reduction Act introduced some price controls on prescription drugs, but the underlying drivers, aging population, chronic disease prevalence, administrative costs, and fragmented payment systems, remain unchanged. Third, housing market dynamics. The United States has a structural housing shortage estimated at 4 to 6 million units. This shortage is the result of decades of underbuilding, restrictive zoning policies, and rising construction costs. Until the supply of housing increases significantly, home values and rents will remain elevated, and property taxes and homeowners insurance costs will remain high. These are not short-term dislocations. These are structural conditions, and they mean that retirement cost inflation is likely to remain above general inflation for the foreseeable future. So what does this mean for retirement planning, and what should you be thinking about if you are within 10 years of retirement or already retired? The first implication is that the 4% rule, the traditional guideline that says you can withdraw 4% of your portfolio in the first year of retirement and adjust that amount for inflation every year thereafter, needs to be reconsidered. The 4% rule was developed based on historical inflation data that averaged around 3% per year. But if retirement-specific inflation is running at 5 to 6% per year, as it has been in recent years, then a retiree using the 4% rule is effectively reducing their real purchasing power every year. The math is simple. If you start with a $1 million portfolio and withdraw $40,000 in year one, and you increase that by 3% inflation annually, you're withdrawing $41,200 in year two, $42,436 in year three, and so on. But if your actual cost of living is increasing by 5% per year, you need $42,000 in year two, $44,100 in year three, and $46,305 in year four. By year 10, the gap between what you're withdrawing and what you need is substantial, and you're either depleting your portfolio faster than expected or you're cutting your standard of living. The solution is to use a more conservative initial withdrawal rate, perhaps 3.5% or even 3%, and to build in a buffer for years when inflation spikes. The second implication is that asset allocation needs to account for inflation risk much more explicitly than traditional models suggest. A traditional 60-40 portfolio, 60% stocks and 40% bonds, is designed to balance growth and stability. But bonds do not protect against inflation. In fact, when inflation rises, bond prices typically fall, as we saw in 2022 when the aggregate bond index declined by more than 13%. For retirees, this means that the traditional safe allocation to bonds may not be providing the protection they think it is. Instead, retirees should consider allocating a portion of their portfolio to assets that have historically performed well during inflationary periods. This includes Treasury inflation-protected securities, which adjust their principal value based on the Consumer Price Index. It includes commodities, which tend to rise in price during inflationary periods. It includes real estate investment trusts, which benefit from rising rents and property values. And it includes dividend growth stocks, particularly in sectors like consumer staples, utilities, and healthcare, which have pricing power and can pass cost increases on to consumers. The third implication is that delaying Social Security can be one of the most powerful inflation hedges available. Every year you delay claiming Social Security beyond your full retirement age up to age 70, your benefit increases by approximately 8% per year. And once you start receiving benefits, they are indexed to inflation through the annual COLA. This means that Social Security is effectively an inflation-adjusted annuity with longevity protection. For a retiree who is healthy and expects to live into their 80s or 90s, delaying Social Security from age 62 to age 70 can result in a monthly benefit that is 77% higher, before accounting for COLA increases. For someone with a full retirement age benefit of $2,000 per month, that's the difference between receiving $1,400 per month at age 62 and $2,480 per month at age 70. Over a 25-year retirement, the cumulative difference is substantial, and it provides a much stronger foundation for dealing with retirement cost inflation. The trade-off is that you need other assets to fund your spending from age 62 to 70, but for retirees with sufficient savings, this strategy can dramatically improve long-term financial security. The fourth implication is that geographic location matters more than most retirees realize. The 18% increase in retirement costs is a national average, but the actual increase varies significantly by state and even by county. Retirees living in states with high property taxes, expensive homeowners insurance, and above-average healthcare costs are experiencing much higher retirement cost inflation than the national average. For example, a retiree in New Jersey, which has the highest property taxes in the nation at an average effective rate of 2.49%, is paying $8,915 per year in property taxes on a median value home of $350,000. A retiree in Hawaii, which has the lowest property taxes in the nation at an average effective rate of 0.28%, is paying just $980 per year on the same value home. That's a $7,1035 annual difference, or $644 per month. Similarly, a retiree in Florida or Louisiana, where homeowners insurance costs have spiked dramatically, is paying $3,000 to $5,000 per year for coverage that might cost $1 out of $200 in Ohio or Indiana. For retirees with flexibility, relocating to a lower-cost state can immediately reduce retirement expenses by 15 to 25%, effectively offsetting the entire 18% cost increase we've discussed. The challenge is that relocation involves upfront costs, disruption to social networks, and potential distance from family, so it's not a decision to be made lightly. But for retirees who are early in retirement and still have decades ahead of them, the cumulative savings from relocating can be measured in the hundreds of thousands of dollars. The fifth implication, and this is the one that most people don't want to hear, is that some retirees are going to have to work longer or return to work part-time. The math is unforgiving. If retirement costs have increased by 18%, but your retirement income has increased by only 12.7%, and you don't have sufficient portfolio assets to make up the difference, then your purchasing power is declining. You can respond to this by cutting spending, by drawing down assets faster and accepting a higher risk of running out of money, or by increasing income. For many retirees, the most viable option is to work part-time, even if it's just 10 to 15 hours per week. The income from part-time work, even at $15 to $20 per hour, can cover the gap between retirement costs and retirement income without requiring you to draw down your portfolio. And critically, it can delay Social Security claiming, allowing your benefit to grow. A retiree who works part-time from age 65 to 70, earning $15,000 per year, generates $75,000 in additional income over 5 years, allows their Social Security benefit to grow by 40%, and preserves their portfolio for later in retirement when they may not be able to work and when healthcare costs are likely to be even higher. Here's the question I need you to think about carefully, and if you're comfortable, share your answer in the comments. Have you experienced retirement cost inflation higher than the official Social Security COLA over the past 3 years? And if so, which expense categories have increased the most in your household? Is it healthcare? Is it property taxes and homeowners insurance? Is it food? I ask this because the aggregate data tells one story, but individual experiences vary significantly, and understanding the specific drivers of cost increases in your situation is the first step toward developing a response. The retirement cost cascade is real, it's measurable, and it's accelerating. The 18% increase between 2022 and 2025 is not an anomaly. It's a reflection of structural forces that are going to continue putting upward pressure on the specific expenses that retirees face. The Social Security COLA is designed to protect retirees from inflation, but it's based on an index that doesn't accurately reflect retirement spending patterns, and as a result, it's consistently undershooting the actual cost increases that retirees experience. This is not a policy failure in the sense that anyone set out to harm retirees. It's a measurement problem. The CPI-W was never designed to track retiree inflation. It was designed to track inflation for urban wage earners. And until there's a legislative change to adopt a CPI-E or some other retiree-specific index, the mismatch is going to persist. In the meantime, the responsibility falls on individual retirees and pre-retirees to understand this dynamic, to plan for it, and to make the adjustments necessary to protect their purchasing power over a 20 to 30-year retirement horizon. If you found this breakdown valuable, if you now understand why your retirement costs have increased faster than your Social Security COLA and what that means for your long-term financial planning, then I need you to do 2 things. First, subscribe and turn on notifications, because this kind of analysis, data-driven, mechanically focused, and oriented toward actionable insights, is what we do here. We're not selling products. We're not pushing fear. We're connecting the dots that the mainstream financial media doesn't have the time or the expertise to connect. Second, share this with anyone you know who is approaching retirement or who is already retired and feeling the squeeze. The people who are going to be hurt the most by the retirement cost cascade are the ones who don't understand what's happening, who assume that Social Security and traditional withdrawal strategies will be sufficient, and who wake up 5 or 10 years into retirement realizing that their purchasing power has eroded significantly. This is about preparation. It's about understanding the timeline. It's about recognizing that the rules changed and that the old assumptions about retirement planning no longer hold. The 18% increase in retirement costs is the new baseline. The question is what you're going to do about it.